Hey guys, Louis here from ndxaction.com, back here with another video. And in today's topic is going to be pretty interesting because we're going to speak about something that it's affecting about 60 million Americans in the United States, and that's a huge number, and that is sleep apnea. And the topic of the video is how to deal with sleep apnea without a CPAP machine, because let's face it, when we get diagnosed with sleep apnea, right, and they tell us, and we find out that we have to wear this mechanical device, it's pretty daunting, it's pretty scary. But the first thing that we need to do as an individual is to be able to understand, why is this happening to us? And the answers are pretty simple. It says that about 50% of individuals who get prescribed a CPAP, they can't handle it, right? So that's a huge problem. And then the other 50% that try to use it, sooner or later, they can't keep up with it. And then there's a huge percentage that also develop infections, because those things have to be cleansed, and it's really extremely difficult. But other than that, some individuals do need it. It could be positive, almost like medication, when sometimes you need those medications until you find out exactly what's going on with your body, until you find a way to reduce these symptoms and find out the causes of these symptoms, and then you could deal with it naturally. The same thing with the CPAP. Sometimes we do need it. It really depends, but the majority of times, I think that if we educate ourselves as far as what's going on, why is this happening, then we probably won't need a CPAP. But of course, I'm going to just put out some information. Obviously, I'm not making this video because I learned about sleep apnea. I'm making this video because I've dealt with sleep apnea. I'm making this video because I am dealing with sleep apnea. And if I don't deal with it accordingly, if I don't sleep smart, because you got to be able to learn how to sleep smart. And you got to be able to understand exactly the most important thing in your life. The most important thing for your health is to be able to sleep accordingly. Because if you can't sleep accordingly, and if you can't breathe accordingly, then we have nothing. You can exercise, you can eat the best foods, but at the end of the day, you need to be able to sleep, and you need to be able to breathe. Now, what happens with sleep apnea, right? When we go to sleep, is that we're not getting enough not getting enough oxygen into our whole central and peripheral nervous system, and that could be a huge problem. But sometimes we cause these things in ourselves, not knowing exactly how to sleep and how to breathe, and we're going to go over that. But a lot of people that have sleep apnea, they develop negative sleeping patterns, and then what happens is they can't breathe accordingly. They snore extremely loud, followed by no sound, and then they wake up gasping for air. So then when it's followed by no sound, they kind of start breathing. So you snore very loud, then you kind of start breathing, and then you automatically wake up. And you have to wake up, because if you don't wake up, then that's a huge problem. Now, sometimes we could snore, but it doesn't mean just because if you snore, you're going to have sleep apnea. But if you snore, you also want to find out why you snore. Let me give you a brief scenario. What happened a few weeks ago? We noticed that my 8-year-old son that never snored was snoring, and I told my wife, listen, I don't like the way that sounds. Something is going on. And then long and behold, we took him to an ENT doctor, and he had swelling in his tonsils, and then he had swelling in the adenoids in his nose. Obviously, then they gave him some antibiotics. They gave him a little spray. 2 days later, he wasn't snoring. After 10 days after the antibiotics, he was cleared. So the first thing that we need to do, if we are having some sort of sleep apnea, we have insomnia, we have symptoms, or we have anxiety, we have symptoms that kind of match up to sleep apnea or correlate with sleep apnea, it's the first thing we need to do. We need to see an ENT doctor. So when you go to see an ENT doctor, you're going to find out if you have any breathing obstructions. You're going to find out if you have any swelling on the nose. Maybe some people have swelling adenoids, like my son, and they don't know it because they're breathing okay. It's just at night you get into trouble. Or maybe they have polyps or some sort of inflammation, or maybe a deviated septum that is causing proper air to flow, or maybe they have swelling in the tonsils, or sometimes, maybe your neck is a little bit too big, but you need to go to an ENT doctor. Now, know that people that have sleep apnea, says that the people that are mostly affected are those that are obese and those that are overweight. And although that is true, again, it's not. Now, most people that are obese and overweight, they're going to have all sorts of problems. But just because you're not obese and you're not overweight doesn't mean that you cannot have or develop sleep apnea, because let's face it, I'm 5'9", 175 pounds. I'm not exactly overweight. I'm actually in very good shape. And I develop sleep apnea. How? Well, when we sleep and when we breathe, okay, we need to be able to breathe through our nose. And a lot of people have the bad tendency of breathing through your mouth. Now, if you breathe through your mouth at night, it's not good. Your muscles are going to relax. You can block your airways. You're not going to get enough oxygen in your brain and body. And then sooner or later, you can develop these symptoms. So mouth breathing, it's a silent epidemic that is affecting the lives of millions of people. You can't breathe through your mouth. You can't breathe through your mouth, period. But then obviously, if you have a problem breathing through your nose, and some people opt to breathe through your mouth, but you need to learn about that. Okay, you can't breathe through your mouth. And I got into trouble. I developed high blood pressure. I developed anxiety, pretty much overnight. But these things were developing in my body for years, and I have made plenty of videos about this. I'm not going to talk about this today. But because of mouth breathing. There's another reason why, a main reason why people develop sleep apnea, and is because they have an overbite. How do I know that? Well, because I have an overbite. Now, when you have an overbite, what happens to you? That means that the position of the back of your lower jaw, it's all the way back. And what does that do? It reduces your airways. It compromises your airways. And then when you sleep at night, you're more prone to open your mouth. So sometimes when I have seen videos, and I have seen many patients from other doctors, and they're dealing with sleep apnea, most doctors, and I say about 90% of them, they can't see that it's coming because of their overbite. And you can tell when someone has an overbite just by looking at their structure. And it's so easy to fix, because all you need to do is fix your overbite. Now, since I have an overbite, I have the tendency of opening my mouth a little bit when I sleep. And I try not to do that, so I have to kind of patch myself up a little bit. Okay? So, the number one reason why people develop sleep apnea, those are in the field of sleep medicine, is because they're obese. But that's not the number one reason. We have to check, are there more obese people in the United States, or there's a lot of people that have an overbite? Now, when these people are obese, it's really easy to diagnose, but all of a sudden, when people have an overbite, they can't. Doctors do not pick it up, and that was my issue. So when you have an overbite, it compromises your airways, and you're going to develop this problem. But it's more than that. An overbite and breathing through your mouth. When you have an overbite and you breathe through your mouth at night, it's going to cause anxiety. It's going to cause high blood pressure. It's going to cause sinuses. It's going to cause a lot of different issues, and I'm going to go a little bit into that. And when it comes to the structure of your face, but it's really easy to pick it up when it comes to someone having an overbite, because everyone that has an overbite looks a certain way. I do a lot of facial exercises kind of to make up, not to have that overbite look. And my overbite's it's not too bad. I kind of learned how to deal with it, and I could get rid of it, but it's a little bit more complicated for me. But it could be much easier for you. So anyway, the question is, how do we deal with sleep apnea without a CPAP machine? Okay, so the first thing we need to do, right? The first thing that we need to realize is that when we sleep, we need to put it into our minds that we can't breathe through our mouth. Okay, so that means that you can't sleep on your back. If you sleep on your back, you're going to be prone to opening up your mouth, and that's not good. Okay, so you want to be able to sleep on the side. You can sleep on the right side, or you can sleep on the left side. But sleep on the side, sleep a little bit more elevated, and try not to breathe through your mouth. Now you might say, well, how do I control that? I mean, how do I know if I'm not breathing through the mouth or not? I mean, it's a good question. Now what happens is whatever you put into your subconscious, whatever you put into your brain can translate later on. When you sleep, you'll do that out of habit. So in the daytime, you want to get used to, you want to make sure that you are breathing correctly. You're breathing through your nose. If you could, I mean, you might have a problem, you can't breathe through your nose, then you have to clear yourself with the ENT doctor. Right? What I'm talking about here now is just, I'm imagining that you don't have any breathing problems when it comes to your nose, and if you do, then you just have to clear that up. You just have to learn how to breathe. You have to exactly know that breathing properly through your nose is not through your mouth, and then you're going to be okay. And if you need a little help, then we're going to speak about this. How do you correct this 100%? Get rid of the problem 100%. And obviously, if you're overweight, then you gotta lose weight, because I can't lose weight for you. So that's something you're gonna have to do. Or maybe you can't lose weight, and then you have to. You gotta wear a CPAP, or there's maybe one last solution if you have that overbite, but I'm not, I can't say it for sure. I mean, you're not my patient, so I can't help you in that way. But for sure, if you're overweight, then you have to lose weight without doubt. So you sleep on the side. Okay, what I do, I sleep on the side, and I sleep a little bit elevated, and then going back during the day, I'm always breathing through my nose. I don't make sure that I don't breathe through my mouth. But proper tongue posture is extremely vital. So your tongue, this is the roof of the mouth. Your tongue, actually, let's go with this side. This is the roof of your mouth. This is your tongue. Your tongue should always be in the roof, on the top palate. Okay. So let's just say you swallow, you want your tongue to be in the top palate. That's the position that your tongue should be in. Now, what happens sometimes when people, they have breathing obstructions when they sleep, maybe they have their mouth open and the tongues are a little bit too relaxed, and it kind of blocks your airway. No, you want your tongue to be forward in the top palate. So during the daytime, I always have my tongue where it's supposed to be. I have my mouth closed, I'm breathing through my nose. You're training yourself. So maybe you have those bad habits that maybe your mouth is open, maybe your tongue is a little bit too relaxed. Then you have to know that the position of the tongue. Okay, the tongue is a huge muscle. It's in the top palate of your mouth, not dangling along. Okay, and then there's a positive thing to that. When the tongue is in the right place, when the tongue is in the right place, this is a huge muscle, right? It elevates your cheekbones, right? Elevates your cheekbones, and you can push your upper jaw a little, and it can push your upper jaw at least in a better position, and then it can make your lower jaw come a little bit forward. But when you sleep that way, or you sleep on the side and you have your tongue in the right position, and then you have your mouth kind of locked. When I go to sleep, I do this. Now I can breathe through my nose with no problem. So in order for you to do this, you have to be able to breathe through your nose, because if you can't breathe through your nose, you're gonna have to breathe through your mouth, so you can't do this. Now this is training here. Now mouth tape is very popular for sleep apnea. In fact, this thing fell. I have here Fix, right? Fix, it's a little mouth strip that people put. It has a little opening in the middle, and you could breathe through your mouth just in case. But it's not like you're taping yourself up and won't be able to breathe. No, you gotta have your mouth closed anyway. You gotta breathe through your nose. You gotta breathe through your nose. So this will help you. This helps me keep my mouth closed and prevents me from snoring. So I put this on. I'm gonna sleep. I go to sleep. Keeps my face in shape instead of opening my mouth, breathing through my mouth. That's no good. When you breathe through your mouth, it can lower your oxygen levels. So I do that. So you want to be able to keep your mouth closed, and because then now you have good air coming in. Okay? If you have your mouth open, then you have bad air coming in, and it also clogs up your nose. So you want to be able to breathe through your nose. Another thing that you could do, right? Let's just say before you go to sleep, I know they gave this to my son, Zarby's, some nasal spray. Make sure that your nose is clear before you go to sleep. That's another way of dealing with sleep apnea, right? And then something else too. I have these nose clips. What the nose clip does, it promotes a little bit more air in through your nose. It goes through your nose. It goes through your nose, and then you have more air go into your body. There's a lot of different types of nose clips. There's one here too. And it's really simple. You put it in, and that's going to, you go to sleep with that. Sometimes I don't put this on much because I could breathe through it in my nose, but I know that when I put this on and I have the tape on, I have a better night sleep. So they have all kinds of stuff. They also have these little filters. All those, I don't like this too much. But they have, at least this one didn't work. It's kind of uncomfortable, but they have better ones. This is like a portable CPAP. And okay, at first, you gotta change the battery. I haven't used this in a long time. The battery died. But it has a battery, and then it has like a filter inside, and then it promotes more air. It says the portable CPAP, but ever since I bought it, I didn't think it was good. If anything, it just hindered. But maybe it was just this one. There are better ones. At least this one didn't really work, but I hear they do. So this is like a portable CPAP. You put it in, and it's going to promote more air going into your system, and that's what you want. You want more air. But the trick is that a lot of people, what happens is they restrict air going into their system, okay, by breathing through their mouth, and by maybe being overweight, by having a chronic overbite. They don't know they have an overbite. So you have to know exactly what's going on. Sometimes people, they say that if you have a neck bigger than 16 inches all around, it's not good. So you want to be able to stay on top of these things, and hopefully this video could definitely help. One thing that I definitely recommend, I use this too, if you want to be able to find exactly what's going on in your sleep too. So I have this sleeping device. As soon as you put it on, right, it gives you your heart rate, it gives you your oxygen levels. So when we develop sleep apnea, right, and when we develop sleep apnea, that means that we're snoring very, very loud, we stop breathing, and then we wake up gasping for air. That's an apnea. Now this thing tells you exactly what's going on if that does happen, because it's recording your sleep. Now usually when people have sleep apnea, your heart rate increases, then your oxygen levels drop. Usually normal oxygen levels are between 98 and 97%, but when you go to sleep, they do lower. But if they go lower, like 91, 89, 88, then that might be a little bit too low. Sometimes 85. It depends who you are. I think my lowest oxygen levels wearing this thing was 88. It did drop a little bit, but it's still not too bad. It's when you're under 88 for a very long time. I was maybe at 88 for like seconds, and then but you have to know exactly what's going on with your sleep. So recording your sleep is key. Okay. So now, what's another way to deal with sleep apnea? Let's just say your problem is that you have an overbite, and most people do. They develop this problem is because their facial structure is not aligned the way it's supposed to be. Now, you're supposed to have a good bite. When you have a good bite, that means your lower jaw is pushing all the way forward. Your upper jaw, it's all the way pushing against the cheekbone, so you're going to have more air going into your system. You're not going to have that problem. And most people that have a good bite, then they can close their mouth and they can breathe a lot better. So you have to make sure that you have a good bite. In order for you to know you have a good bite or not, you go to your dentist. Your dentist will be able to tell you if you have an overbite, but you got to be able to have a good bite. And then a lot of people too, that they have sleep apnea, they also develop tooth decay, gingivitis, all kinds of stuff, bad breath. So why? Because they breathe in through their mouth and they don't know. One of the things that I always told my kids, you got to breathe through your nose. My daughter, breathe through your nose, not breathe through your mouth. So if you have a child and they breathe in through their mouth all day and all night, you have no idea what's going to happen to the health of that child. They could develop asthma, and all of a sudden you take them to the doctor, they have asthma, and the doctor's like, well, it could be a genetic disposition. It's not a genetic disposition. It's because the kid is mouth breathing. You can tell by the shape of his face. I know just by the shape of a kid's face if it's mouth breathing or not. Why? Because they already develop an overbite. They develop really massive crooked teeth. The teeth are not growing accordingly. They have lower cheekbones. They have a sad looking face. They have a droopy look. Now, kids should have a nice jawline. They should be developing a good bite. So when you breathe accordingly, you develop a good facial structure, nice high cheekbones. They don't have that depressive look. So I can tell the kid right away, but obviously, sometimes I have to keep my mouth shut because the kid is not coming, the parents are not coming for those issues. But you can know, and then once you start educating yourself about that, about facial structures, you're gonna know who's a mouth breather and who's not. Because when you breathe through your nose, your face develops different. When you breathe through your mouth, your face develops different. And if you're a nose breather, and now all of a sudden you're 30 years old, 40 years old, and you start breathing through your mouth, guess what? Now you're going to accelerate your aging process, and you're going to have all sorts of issues because you're breathing through your mouth. When you're 40, then by 50, you'll definitely have anxiety, high blood pressure. You have all kinds of issues, and all of a sudden it's coming from you because you're mouth breathing. And you're going to go to your precious primary doctor, and he's not going to have a single clue. Medication, anxiety, and you have no idea that is coming from your sleep. That's why I said before at the beginning of the video, the most important thing that we could do in life is be able to sleep and breathe accordingly. So if you find out exactly what's happening in your sleep, then you're going to be fine. You're going to have a perfect foundation for your health. Obviously, you might develop some issues here and there, but you're going to be much healthy. You control your weight, you control your sleep, you control your breathing, and you're going to be fine. Just a matter of educating yourself. You have to know how the body works. You have to know what the body structure is supposed to look like. You have to know what your face is supposed to look like, and then you can work with that. Now, I mentioned before, you go to the dentist, right? And then that dentist, if he's an educated dentist and you tell him exactly what's going on, then you go to a sleep medicine dentist. And then that educated sleep medicine dentist will take an impression of your mouth, and he's going to make a dental device for you that looks like this. There's another way you can deal with sleep apnea. I know this because I had the dental impression. And there's a couple of good things about this and a couple of bad things. Now, this thing here, it's the top, no, it's the bottom here. Okay, you put it in your mouth, see? You put it in your mouth, it's a nice little mechanical device. You put it in your mouth, and it's going to push your bottom jaw forward. It's going to keep your mouth in place. The bottom jaw doesn't fall back, closing your airway, because that's what happens. If you snore loud, if you stop breathing, and all of a sudden you wake up gasping for air, it's because you closed your airways through your nose and through the back of your throat, by your tongue being in the back position, by the bottom jaw falling all the way back. You close it, and then no air comes in, and then you wake up gasping for air. Like, what the heck is going on? This helps you from that happening. Now, this, I have not used it in a long time because my issues with sleep apnea are not at a high level. I have all these little gadgets here that I use, and I know how to take care of myself. You exercise, you maintain yourself slim. Also, forgot to mention if you know how to do some facial exercises, it helps you push your jaw forward. It helps you strengthen these muscles so they don't fall back and relax, and then they end up closing on you. But the only thing that I don't like about this piece, maybe it's just this one, which I have to investigate, is that it's uncomfortable. Very uncomfortable. And I really can't close my mouth. I could, but it's very, maybe I have to get used to it. But I got this months ago. I never went back to the doctor because I feel like, you know what, I'm not going to wear this piece like this. And I stopped wearing it. But if you get one of these pieces and you don't like the way it feels at night, what you do is, what I'm going to start to do, is that you can wear it a few times a week. And that helps you stretch your face a little bit, strengthens your muscle. It pushes your jaw forward. It doesn't let your bottom jaw start falling back. If that's the case, all these muscles to get weaker and weaker. It strengthens. So it's almost therapeutic. But to sleep with it, I don't know. I mean, I had Invisalign. You can sleep with Invisalign. I had a retainer after Invisalign, and that I didn't have a problem with it. So if they can develop some sort of sleeping device for sleep apnea, that it's like a retainer or Invisalign, it'll be much better. But guess what? Something just dawned on me. When you have a retainer, you know what? If you're listening, I really hope that you're listening to this. We need to pause for a second because I just kind of remember something. Now, because I was supposed to mention before you go to the sleep medicine doctor. Now, obviously, I did something before I went to the sleep medicine doctor. 1 second. Okay, I did something different. I did something before I went to the sleep medicine doctor. My sleep medicine doctor, this is, I wouldn't say my last hope, but it's a good way of dealing with it. But what you could do, it's what I did. So you go to your dentist, and if you have a overbite, all you have to do is correct your overbite. And you do that by getting braces. You do that by getting Invisalign. You do that for whatever means, and you can correct it. Now, I didn't qualify for that because I had Invisalign a long time ago, but since I was dealing with this sleep apnea situation, I didn't have sleep apnea when I had Invisalign, but I was breathing through my mouth. And then what happens when you breathe through your mouth, you develop a lot of tooth decay, a lot of problems. With Invisalign, it really messed me up. And I ended up losing a lot of bone. I couldn't finish the treatment. So when I went to have an impression to maybe see if I can qualify for Invisalign to try to correct my bite a little bit, the doctor said, no, you lost too much bone. You can't be moving bone around anymore. But maybe you can. You know how many people I see that have an overbite. And if they fix their bite, not only does it improve your breathing, but it also improves your physical facial appearance. You ever see what a face of a model looks like? They're attractive. Why? Because everything's in place. So your bite is the foundation of your face. Can you imagine a nice, beautiful house with no foundation? What would it look like? Well, it's not going to be solid. It would be crooked. It wouldn't look right. Well, the same thing happens with your face. If you don't have a solid foundation, if you don't have a good bite, then your face is not going to look right. But when you fix your bite, your jaw comes forward, you enhance your profile, you have a nice wide smile, it pushes up your cheekbones, it gives you a facelift, and even your nose gets better, gets more line. And you know, I learned that when I had Invisalign, I always kept looking. It's like, wow, I look a little better. Why do I look better? Maybe I'm getting better with age. This is like back in 2011, 12. My nose was pointier. It's like, interesting. Why is that happening? Maybe. And it was when I went to the doctor, my orthodontist. And orthodontist is the one that gives you braces, right? It takes an impression of you. He's like, oh no, what happens if this is why? I'm like, wow, I had no idea. So you learn. So if you fix your bite, not only is your physical appearance going to improve, but also your breathing is going to improve. So that's another avenue. You go to an orthodontist, you fix your bite. If you can't like I do, then you got to have one of these devices. Now, one last thing that you could do, and I might do it, but I don't know. My wife would be against it. It's a little steep. You can also have surgery where they can fix your bite. Now, my bite is not too bad. There's some people who, at least when I went to the doctor, right, the orthodontist, he said, oh, listen, you look okay. You know, you don't have that critical look where you have to have this type of surgery, but I understand if you want it just for health reasons. But I know how to take care of myself by doing, taping myself up and make sure that I sleep accordingly. Because as I get older, I don't want to weaken my structure here. And the number one recipe of weakening your structure, especially when you have overbite, when you sleep, is to breathe through your mouth. So I can't do that. So I always have to work to always push my jaw forward to keep my face aligned. And then I do that by facial exercises. I do that by having proper tongue posture. When you have proper tongue posture, the muscle can lift up your cheekbones. It can lift up your smile, and then it can push that bottom jaw forward. And then I have these devices that can help out. Okay. Now, one thing that I forgot to bring here into the table is I still have, so when I had Invisalign, right, I still had a retainer. So now the top retainer, for some reason, I couldn't, I threw it away. I think I lost it. But I saved the bottom retainer. And guess what? Sometimes I put the bottom retainer on. So when I put that bottom retainer on, it keeps my lower jaw from falling back. And it's a lot easier for me to close my mouth. And I don't have to wear the tape. But sometimes I wear the tape too. And I sleep accordingly. So that's another avenue that you could do. Let's just say that you can't wear this thing like I can. My thing is, why I might go to my orthodontist. I might be like, listen, can you make me I got the bottom, but I need the top one too. Can you make me a retainer? That way it just keeps my structure here, my bite in a fixed position. So that way it just doesn't fall back. Well, sometimes you could be sleeping, you sleep on the side and everything, but you know, sometimes you can make a mistake and lie on your back and open your mouth, and then man, you can wake up, you can catch an apnea. So if I have that device on, then it's not going to happen. And like I mentioned before, surgery, it could be, they have sleep apnea surgery where they can fix your bite. But I'm telling you that a lot of people have an overbite and they do not know that that's where the problem is coming from, because I have seen a lot of interviews and video and the patient has an overbite and they're talking about exercises, they're talking about eating. That's not going to fix it. It can help. Listen, if you exercise, it's going to open up your lungs. You're going to be able to breathe better. So that's going to help. But it's not the solution. The solution is the overbite. This patient is speaking and I can see his face, his bottom just all the way back. He has like no neck. He has a lot of fat on his neck. He has his upper teeth are all the way forward. You can see them. His nose is drooping. His eyes is droopy. The cheekbones, there's no cheekbones. So how are you going to look that way? I mean, do a sketch of yourself. See, you're not going to look right. You're going to look depressed. You know, that's why a lot of women, what happens when they turn 50, they turn 60, they do the most idiotic thing in the world. They get Botox or they get cheek enhancements. Why are their cheeks drooping? It's because when you get older, your bite starts to shift. You look at that and then you start to look different. You start showing more teeth. You don't have that nice jawline no more. Your cheeks, so all they have to do is just fix their bite, get an orthodontic consultation when you get older, 50, and it's going to give you an amazing natural facelift. That is the best facelift that you can give yourself, because when you inject Botox into your cheekbones or whatever it is that you do, it's not going to fix your bite. And that's why people look horrible. I mean, women look horrible. And I have to make a video about that, because it's like, my God, if they only knew how bad they look, just fix your bite. And that's it. Listen, there's some people who do very little when they get older, but everybody wants high cheekbones. Why? Because that's the way the facial structure is supposed to be. Nice, pronounced cheekbones. And you can have that if you fix your bite. But not only is it going to enhance your physical appearance, but it's going to enhance. But anyway, I don't know if I missed anything. If you have any questions, we can make another video. I haven't made a video in a long time. I'm working in a lot of different things. My digital marketing company, my electrodiagnostic company. So I have a lot of things in place, but I can't forget that I do have an audience here, and you guys pretty much need my help. And I'm going to walk through you guys. I'm going to help you guys from experience, because I deal with this now. But I sleep fine. I don't have any high blood pressure anymore, thank God, which I did before. I don't have any anxiety whatsoever. I don't have any insomnia. I go to sleep, and the other day I was so tired I went to sleep at 11 o'clock and I woke up at 7 o'clock in the morning. Straight. Beautiful. When I had my sleep apnea and I was developing insomnia, I couldn't sleep. I was like, what the heck is going on? But what happens is, it peaked in 2017. That's when I got it, but it was already developing since 2010. You see, we need to educate ourselves and use preventive measures, and hopefully this channel will be able to do that. But I'm not saying, listen, that I'm not saying you can't use a CPAP. I'm saying that studies are already showing that 50% of the people that prescribe a CPAP, they can't deal with it, and then another 50% out of that they can't continue to deal with it. So the CPAP, it's not the lasting solution. I think that maybe the device, it's a lot better. Oh, I forgot to mention, it's a company called Blue Sleep. Blue like the color blue, and sleep like sleep. I'll link it in the description below, bluesleep.com. They have a lot of these devices, and I am going to call to see if maybe there's like a more comfortable one, because some of them I saw a little small. So if I can get one in the future that's like some sort of a retainer, then I go, because it does push your jaw forward. I like the way what it does. It's going to open more air, and that's about it. Because surgery wise, there's nothing that an ENT doctor could do for me. Because sometimes if you could have the sleep apnea, right, and all of a sudden the ENT doctor says, oh, listen, you have a really bad deviated septum, so that's the problem. Or maybe you have a lot of fatty tissue here, that could be the problem. But surgically wise, there's nothing. The ENT doctor saw my nose, saw my throat. There's nothing that he could have done for me. But maybe for you, it's a whole different story. But you got to get yourself checked out. If you have any questions, maybe I did miss something, I completely apologize. And I hope this video really helps people. I hope that I was concise and clear. But feel free to comment, and I'll see you in the next video. Bye bye.